Hello and very good day to everyone. I am Dr. Rahul K Jaiswal, Associate Professor of ENT and Head and Neck Surgery. Welcome today to a very small lecture on bleeding from nose, first hand approach. Basically, what should we do when we see blood coming out from your nose? So, the first thing is that we have to understand where does the blood come from. So the blood is coming from a confluence of various arteries and veins that is affecting the Little's area, that is the anterior inferior part of the nasal septum, and also on the posterior part, the Woodruff's plexus. These are the two commonest areas of bleeding. Why is there an epistaxis? Epistaxis means bleeding from nose. Why can it be there? It can be because of a septal angioma. You see, this is a septal angioma. There can be bleeding polyp, the polyp which is bleeding. There can be inverted papilloma, and there can be a mass protruding through the oropharynx. Other causes are a rhinolith, a leech in the nose can also be one of the causes for bleeding. So this for the local cause. There are some systemic causes of bleeding. People who are on aspirin, fexofenadine, warfarin, ibuprofen, these drugs will have tendency to bleed. That is why we must measure PT-INR on these patients regularly. Alcohol causes bleeding. Blood dyscrasias like leukemia, hemophilia, thrombocytopenia will cause bleeding. Heart failure, hypertension, infectious disease, malnutrition, pregnancy, hepatic failure, and Osler-Weber-Rendu disease. This is a very rare dominant equal sex distribution dominant gene disease. This can be one of the cause for systemic factors. There can be drugs which causes epistaxis. One of them is cocaine, and one of them, very commonly we use the nasal drop which contains xylometazoline. If you use the xylometazoline for more than 5 days, they are found to cause us rhinitis medicamentosa. So no Otrivin or Nizivion for more than 5 days, please. Right? And how do we manage? The basic best method is the Hippocratic method or the Trotter's method. You pinch this area of the nose and ask the patient to sit in a semi-recumbent position and breathe through the mouth. If the blood comes through the mouth, spit on the petri dish that is present in front of the mouth. So this is how you can control bleeding in the first episode itself. So that is why do not panic when we see blood. Just have the idea that Hippocratic technique or the Trotter's method, the Trotter's technique will help us to manage bleeding. So this is the position of how the patient was to sit. He is to sit with his nose like this, with the handkerchief like this. So this is the most important position, and not like this. Never on the back side. Not like this once you are bleeding, because the blood will go from here to the nasopharynx. That means it goes backward and then it will come through the mouth. So this is the semi-recumbent position on which you will have to manage the patient. Right? So thank you very much. I hope this small video would help us to understand and manage bleeding from the nose and not panic. All the best.